Risks of Swan-Ganz catheterization. More common risks of a POC procedure include bruising at the site of the POC insertion, excessive bleeding, vein injury or tear, pneumothorax, or lung collapse, can also occur as a result of a puncture to the lung. This is more common when the catheter is inserted into the neck or chest veins. Less common complications include blood clots, low blood pressure, irregular heartbeat, cardiac tamponade, in which blood or fluid builds up around the heart, compressing the heart and resulting in inadequate filling of the ventricles. The most dangerous risk of a POC procedure is pulmonary artery rupture, which has a 50% mortality rate, according to one study. This is a rare complication that most often affects women over 60 years old who have POC. It's also more of a risk for people receiving anticoagulation, or blood thinning, therapy. Controversy surrounding Swan-Ganz catheterization. Swan-Ganz catheterization and other PACs have been the subject of controversy over the years. This is in part because of a 1996 study led by Alfred F. Connors, Jr. of Case Western Reserve University. According to the study, the POC procedure might increase the risk of death for people who are critically ill. Additional studies have since questioned the usefulness of the Swan-Ganz catheterization as unreliable, inaccurate, and poorly understood and misinterpreted by medical personnel. More recent technologies offer less invasive and reliable results. They include transesophageal echocardiography. This is a type of echocardiogram. A small transducer is guided down the throat to behind the heart to view any problems. Pulse contour technology. This is a non-invasive system that continuously and comprehensively monitors cardiac output using an arterial line, or catheter. Dynamic assessment of fluid responsiveness. This is a continuous assessment of how responsive the body will be to adding fluid to increase cardiac output. Sometimes giving fluids won't help increase cardiac output. Despite these controversies, POC still has a role in the diagnosis and management of POC and acute right ventricular failure. Subscribe us to know more health tips and home remedies.